I just have two other chronic illnesses that I wanted to talk about in this lecture on different health issues in older adulthood. And these are chronic issues that are quite common among individuals who are elderly. So the first one is osteoarthritis, which is one form of arthritis, and this is degenerative joint disease. And essentially what's happening here is that we have cartilage that is, between bones and it's cushioning the bones. And over time, this cushion wears away. And so bones can feel like they're on top of one another, which is unpleasant, or it can result in swelling, or I should say, and it results in swelling. And ultimately, what this affects is that it affects one's ability to move those joints, and it also is quite painful. It can affect any of the joints in the body, but most often we see individuals who are struggling with arthritis in their hands, knees, hips, and spine. And so, really, it could be a whole body experience. I imagine that many of you know individuals who are struggling with arthritis. Um, I'm not talking about rheumatoid arthritis, that's a separate autoimmune issue, but osteoarthritis is affecting many, many individuals. You see from some of these statistics that about a third of people are affected this by the age of 64, so not even into old age. And about half 65 and older are, we have reports that they have osteoarthritis or they're being treated for arthritis. In reality, these numbers are probably even higher of individuals who aren't being treated for it or who haven't talked to their doctors about it and have seen it just as a normal sign of aging, which it is a normal sign of aging. But it's probably affecting even more than just that half. And for that reason, it's not important that you know those specific numbers, but you should know that it's a sizable percentage of people who are experiencing arthritis. Um, I think about my own grandma again, and she used to crochet all the time, which sounds like such a grandma thing to do. But she's unable to do that anymore because of arthritis in her hands. It's just too painful to do that. So there are many individuals who struggle even doing those, again, affecting those daily life activities, not even just hobbies, because of the pain that they're experiencing from this chronic illness, but a chronic illness that is quite common and seemingly almost part of normal aging. There are environmental factors that influence one's likelihood of having arthritis. Just in general, some hobbies are more associated with arthritis. Like I said, crocheting is going to be associated with, using your hands more and wearing down those cushions, that cartilage. Other people who are quilters, for example, might have those hand issues. People who are runners are going to have this experience. They might have this experience in their knees and lower parts of their body. Certain jobs, I think about dental hygienists whenever I go to get my teeth cleaned. And, they talk about carpal tunnel. That's quite problematic among that population. But arthritis is probably right up there as well. Obesity, because obesity affects our overall body functioning, but it's also putting more weight on the body. And if you think about how this is affecting the hips and the knees, and the tissue wearing away because of that. So yes, environmental factors are definitely at play. They're not the only factors that can be a normal part of the aging process, but when we're looking at specific joints and which specific parts of the body are affected, we definitely can see how the environment is affecting, where we see this arthritis happening. And last but not least, I want to revisit something that we've talked about when we started talking about middle age and when we're talking about menopause, and that's osteoporosis. So, osteoporosis is severe bone loss. And what it results in is brittle bones. And you can actually see these four bones. I'm not sure which bone that is, but the four bones in the picture on this slide here. And I mean, as a whole, bones are supposed to be porous, but if you look from the left to the right, the one on the right is obviously showing more porousness, and this is representing more advanced osteoporosis. What's happening here is that with advanced osteoporosis, one, we see bodies shrinking, but the biggest problem is often that this is increasing the likelihood that somebody is going to hurt themselves, to fracture a bone. And as we get older, it takes longer to heal. And obviously, if we're not able to take care of ourselves because, let's say, we end up, hurt or with a broken bone, then this can also be problematic. So some numbers for you. 10 years after menopause, again, this is speaking specifically to women. We see that on average, 25% of bone mass is lost. Is this necessarily osteoporosis? No, it could be normal aging as well, but that's quite substantial, showing the role that estrogen plays in our bones and in I mean that's related to a lot of different factors. When we look at men too, though, men are still experiencing osteoporosis to a smaller degree, though. So about 30% of women and 16% of men will experience extreme bone loss. So not just bone loss broadly, but more extreme levels. We do know that there are risk factors for osteoporosis, which I've talked a little bit about in middle age. But we also know that there are some environmental or lifestyle choices that could affect the progression of osteoporosis or things that can lessen the effects of osteoporosis from getting worse. So individuals who are engaging in exercise, again, still appears here, or have diets that are high in calcium and vitamin D, these can be like almost protective factors. Maybe not making it go away entirely, but lessening some of those symptoms and ultimately making it so that if someone, falls or gets injured, then it's not a significant injury that is affecting their overall quality of life. So as I mentioned, the last presentation that we have in this class will be on death and dying. Some of the information in that will be helpful to you as you are completing your cross-cultural assignment. So if you haven't done your cross-cultural assignment yet, I would wait until you hear the last lecture because you're going to need some of that information. And it'll be particularly helpful to you. So just one more lecture.